Hello, everyone, and welcome. My name is Meena Dayak, and I am the Executive Vice President, Market Intelligence at Open Minds. I am not going to be talking to you about aggressive business development strategies today. That'll be my colleague, Paul Duck, but I'm going to serve as your moderator, and I did want to give you a bit of a brief introduction to our topic today and to Paul. So, as all of you continue to navigate through the crisis that COVID-19 has presented, and especially as you start thinking about what happens after the crisis, when you go back to whatever the new normal is, what does recovery look like? How are you going to have to change the way you do business? There is a lot to think about, and so we at Open Minds are here to help you out. We've developed a program called the Executive Blueprint for Crisis Management. And through this program, we are bringing you web briefings like the one today to give you some tools and resources and ideas to think about where you should go next and how you can actually plan for long-term sustainability as well as recovery from the crisis. And my colleague and Open Minds Senior Associate Paul Duck will be walking you today through aggressive business development strategies, and he will be providing lots of ideas and examples for adding to your top line with breakthrough services. So Paul brings over 40 years of experience in leadership and management, focusing on managed care, health information technology organizations, strategy, business development, market expansion, and customer experience optimization. The list is impressive, and I'm really thrilled and excited that Paul is here to share his expertise with us today. Just a couple of housekeeping reminders. You are not able to speak today during the web briefing so that we can ensure good audio quality overall, but we do welcome your questions and comments. You will see a question box on the right of your screen, so simply type anything you wish to type, whether it's a comment, a question, or a thought that you'd like to share with Paul or with Open Minds today, and just send that in at any time during the briefing. And after Paul is done with his presentation, he is going to take the time to address every one of your comments and answer your questions. So we are looking forward to a dialogue with you. And I know that everybody is always eager to know whether the recording and slides from today's briefing will be available. The answer is yes. We will be posting the slides as well as the recording on the Open Minds website. And you will also get an email today from my colleagues with a link to where you can access that. So you expect to see that this evening or tomorrow morning, but the slides will definitely be available to you. With that, I will hand it over to you, Paul, and take it away.
Thank you, Meena. I appreciate that very much. And good afternoon. We certainly are in a time that none of us certainly expected, a 100-year event, I think, as it's being called. And obviously, it's presented a lot of challenges, but I also believe in all challenges, there are opportunities. We are seeing tremendous pressure being put on various parts of the health system. Certainly, behavioral health is a key component of that, as well as intellectual and developmental disability facilities and other human services. The way people are responding to this, and just in working with the Open Minds clients, it's striking the innovation that's happening underneath this. I would say the key attribute I've seen is that in this particular pandemic that we're dealing with, it has accelerated a lot of the things that were going on beforehand. And we'll talk a lot about that this afternoon. And I think, you know, what we're going to talk about really is about business development, but also about some of the key things that you should be doing, practical information. Whenever I attend a webinar or a session at a conference, I want something practical to do. So I got some examples for you this afternoon, and also some practical to-dos I think that will really push us ahead. So we're going to, it's broken into these 7 components: responding to the urgent needs of the market, repurposing and repositioning in this whole virtual market that we're now living in, this virtual way of doing business, diversifying through geographic expansion, and geographic expansion has even taken on a whole new definition, I think, in some ways. Fundraising for the short term, how do you fundraise in this new environment? Identifying competitor contracts that are at risk. So not everyone's responding really efficiently and effectively. What do you do with that? Anticipating local organization failures and the service needs that are created around those. And then, of course, lastly, exploring the avenues for government support, which we've seen several, and I'll share with you some examples, some places to go to find some of those resources. So let's go ahead. So first, I like setting context for the problem because I think it's important. While, we could probably spend an hour talking by itself just on context, I just really want to kind of set the tone here. I really kind of pulled these pieces of information out because I think they're illustrative of a problem that existed and it created additional distress. So if you look at this survey that was done very, very recently, of course, as a result of COVID-19 in the US, both anxious and depressed, it broke down between people that had lost their jobs and people that had not. But if you look at the statistics here, 63% had some form of anxiousness, depression, in the mix, so to speak. And then if you look at the folks that have experienced job loss, that's 74%. Experience some form of depression, anxiety, which of course in many ways is to be expected. Now, if you flip over to the right side of the screen here and look at the way people are responding to this, it's kind of almost frightening in a lot of different ways. So if you look at levels of distress that are going on, you can see again between the all respondents and then the job loss folks, 1 out of 4 across the board report to have experienced binge drinking at least once in the past week. 1 out of 5 reported taking prescription drugs for non-medical reasons, and 1 out of 7 reported using illicit drugs. So those are frightening statistics. So realize that, I think there's been a lot published, and certainly on Open Minds and the Open Mind Circle has published a lot of information as it relates to the way people are responding to this. But I think this is really kind of the bright shining moment for behavioral health and those people, those organizations providing services to this population. And I think the significance of the expansion of this population will be paramount in terms of the months coming up and how you deal with some of this, because there's going to be a lot of demand. Let's go ahead. So again, you look at the entire United States population that has some form of insurance is about 294 million people. And then if you look at the spend on the right side of the screen here, roughly $2 trillion is spent. But again, if you look at the statistics here, those individuals with a behavioral health diagnosis make up about 23% of that entire population. So, I mean, roughly speaking, that's a gigantic piece here. So you're looking at, of the 23%, is roughly $68 million is spent specifically around that. So if you translate that over to the right side of the screen here, 60% is spent in some form in relationship to behavioral health, whether it is a pure spend on behavioral health services, which makes up 7%, or if it's, adds in those the spends that are happening with people with a behavioral health diagnosis, or maybe a co-occurring comorbid condition. So it's a very significant amount of spend that's happening here as a result of a problem that's existed, but now it's being amplified even quicker. Go ahead, Liz. So I think there's 9 key pandemic trends that we've seen happen. And I think, again, as I said earlier, these are being accelerated in some of these are being accelerated just as a result of having to be much more responsive in this pandemic environment. So the one is the transition from fee-for-service to value-based payment and alternative payment models. There will be a lot of different ways payment occurs. And I think, again, the acceleration of that and the movement towards quality and the reduction of cost and looking holistically at individuals as opposed to just looking at their diagnosis is really going to be a result of this. But again, I think it's going to be accelerated by this pandemic. Number 2, we see a movement towards traditional, more distributed settings. So, obviously we're all working, most of us, I would assume, are working in our home or also in the workplaces, but we're also now experiencing telehealth, which wasn't, it was being implemented and actually implemented fairly quickly, but we've seen a tremendous acceleration. And I'll show you some examples of those that's happened with telehealth here in the last month or so. Number 3, Payers and purchasers desire to identify the total cost of care as a key component to understanding the value of healthcare services. Payers and purchasers are obviously stressed just like provider organizations are, but if you think about what they're really trying to do in terms of pre-pandemic was, again, this identification of total costs. This is only going to be amplified by people, especially with comorbid conditions, that will now be a lot more hopefully accessible and will push integration a lot faster. Number 4, consumer, employer, purchasers need for greater convenience, and obviously convenience. A lot of people have different definitions for this, but I'm the kind of healthcare consumer that I want it, and I want it now. I don't want to go sit in a waiting room if I don't have to. And again, telehealth, texting metaphors, additional tools that have been added to employer suites, all of those are contributing, and those are the ones that I see being retooled even quicker in the pandemic. Number 5, increasing use of data and analytics and greater EHR interoperability to inform healthcare delivery at all levels. And again, while this isn't necessarily being accelerated, the need for it will have to be accelerated. In other words, the amount of stress in additional services that are being placed on the healthcare system in general, you have to find an offset. And the reality is that we know there's a lot of spend that happens in the physical health world that really, a lot of the treatment should be focused on behavioral health. Diabetes is a great example of that. COPD, there's a lot of those kinds of situations. Number 7, clinical professionals taking ownership to address social and economic determinants of health. Social determinants of health and peer supports both are top of mind topics for our industry. And again, the clinical professionals are taking ownership to address these, and those rules have all changed in this pandemic environment. And again, the challenges certainly are plentiful. Number 8, integration of provider organizations and payers under new incentives to make care more affordable, efficient, cost-effective, and consumer-focused. This is a big one. We actually are seeing a massive decrease in the number of people that are insured in this pandemic environment simply because they've lost their job and their employer no longer provides that health insurance for them. So we actually will have to dig in deep, I think, as a nation to really kind of dig out a number 8 here. Number 9, upskilling, the downscaling in healthcare labor force with new technologies like artificial intelligence for clinical decision support. And again, this is, and I'm a strong believer in the use of AI and clinical decision support as tools that inform providers just at the moment that they need information. I think that we're in an environment now where people need information a lot more readily, and I think that the acceleration of those kind of tool sets is desperately needed, and it will be amplified, I think, by the pandemic. Okay. So now let's talk about responding to the urgent needs in your market. And I think they really break down into 2 components. And again, this may be an oversimplification in terms of the things you need to think about when addressing kind of the urgent needs in the markets. And one is serving individuals in crisis. We've certainly seen a tremendous pressure being put on populations and communities across the country. The second is addressing crisis-related needs of payers and managed care organizations, the folks paying for the services. And again, the crisis is again impactful in most of those payer organizations, whether we're talking about a public sector payer or a private sector payer. Both are seeing and experiencing a tremendous amount of pressure as a result of that. And it really brings about opportunities, I think, for provider organizations. Go ahead. So let's look at 3 examples I kind of pulled out, and we've got more than this, but these are ones that I think are really kind of illustrate the creativity of provider organizations in dealing with an environment where face-to-face is virtually impossible, or at least challenging at best. So looking at volunteer mask production. So North Range Behavioral Health, they operate a crisis center, basically an outpatient treatment that's really transitioned to a telehealth model and detox services. And again, when the executives at this treatment center learned of the mask order wouldn't be fulfilled until May, they actually launched a volunteer-based campaign called Sew for Hope. And they launched it early in the pandemic environment on March 19th. In 3 weeks, it attracted 36 volunteers that produce nearly 700 masks plus gowns plus headbands in a day. Or within that time frame, sorry. So the reality is that volunteer mass production, again, it brings people together, allows them to engage, very powerful in terms of meeting community need. And again, that is kind of the reflection in business development that you really want, your organization wants to be identified with, your brand wants to be identified with. The next one is at Centerstone, a multi-state health and human services organization. Their care team found an option for consumers, and this is really the ones that were taking antipsychotic medication to require blood tests and for refills. So they actually developed a curbside blood testing, which enabled the consumer to get the refills without being exposed to the traditional clinical setting. Again, a lot of creativity went into figuring out a problem and then trying to figure out a solution as quickly as they could. The next one is improving telehealth access and planning. At Mental Health Partners, which is again a not-for-profit organization that offers mental health services and addiction treatment, the team started buying cell phones for telehealth and revamping a way it produced the protective equipment for staffing. So again, a very creative way in terms of addressing a pandemic environment, an environment where people weren't leaving their homes, but making that quick pivot from a brick and mortar kind of mentality to a telehealth model. There really are the organizations that are doing that. There are several, and I'm positive that there are several organizations that are on this web briefing that have done the exact thing. And the reality is that it's something that was, again, I think telehealth probably is the best example of one that we saw a trend happening prior to COVID-19, and now you've just seen a tremendous acceleration. I've seen organizations go from doing 0 telehealth visits to doing over 12,000 visits or more a week. So there's a lot happening relative to organizations that are succeeding, are doing so through innovation, and they're developing a whole new reputation within their community, and which again brings about business development opportunities from both payers and also the community providers. Okay. So again, addressing crisis-related needs of payers and managed care organizations, obviously a key attribute in terms of trying to stay strong in this environment in terms of the key payers. So again, I came up with my own kind of ideas, and again, some of these are borrowed from organizations and seeing what they're doing, but others are obvious. I could probably sit here and I could, if my colleague Monica Oss were here, we could probably sit here and do a whole session just on this topic alone. But here are the 4 I came up with: delivering EAP-like services to support workers at your payer in your managed care organizations. The staffing within a payer is no different. Their employees, their team members are having the exact same experiences that we saw earlier, and I showed you the statistics around the amount of stress and anxiety this is placing on individuals. The people that work in managed care organizations and payers are no different. So the reality is that it gives an opportunity for you to actually pivot and provide some of those services to your payer, which actually could be doing the right thing for a business partner, more or less. Next one is filling the gap for access to care with virtual delivery models and development of specialized services such as 7 and 30-day follow-up after psychiatric hospitalization, the HEDIS measures, the big high visibility ones for the behavioral health industry. And again, if you think about it, developing almost any kind of specialty service, it really is could serve you well. And in the pre-pandemic environment, that development of those kinds of services was obviously top of mind for a lot of kind of innovative organizations. Now what's happened is that this is really, the pandemic has caused an acceleration in the need to actually move those services forward a lot more quickly and to meet the need. And again, there's a lot, you look for where the pain points are with payers, and you try to fill in the gaps of where those might, fulfill and actually have longevity. So long after the pandemic has moved by, or we're dealing with it a different way, the reality is that those services are high value. Delivering mental health services to healthcare workers at local hospitals serving COVID-19 patients. And we've read plenty of stories about some are horrific and some are just illustrations of tremendous amounts of stress and just dealing with COVID-19 patients. These healthcare workers really are experiencing a lot of mental health trauma and stress. And again, it's an opportunity. There's no organizations better equipped to be able to help hospitals and other healthcare workers deal with these kind of crises in this crisis than behavioral health providers. And then the last one I came up with is, offering services to those that are incarcerated. I think, if you think about it, there's a lot of mental illness, sadly, in our jail system, and those services are going to be challenging to be delivered in a COVID environment. But if you can deliver telehealth services for the incarcerated or some other mechanism, or you may see providers that were providing those services that no longer can deliver those services. There's lots of ways that you could step into that environment, I think, in corrections in general, and potentially have an open door. But, talking to your local sheriff or other law enforcement in your community about this, again, lots and lots of ideas, but you have to get way outside of the box in terms of the way you've thought about business development and start to think about it in new creative ways. Let's continue. So urgent market response. So if you think about, those screenings that could or should take place now on a telehealth platform, I think is kind of top of mind of many organizations, again, that are moving ahead in a very innovative way, proactively engaging high-risk patients. We know high-risk patients, or those that have severe mental illness, higher levels of acuity, maybe in the IDD setting, all of those are potentially going to be aggravated by this whole situation. So organizations are actually taking proactive steps to not wait for them to be in crisis, but to actually make sure that they're not going to enter crisis, especially if you are in a situation where you have a value-based arrangement with a payer. It's in your best interest, your best financial interest, but it's also in the patient's best interest to be able to doing those outreach early as opposed to waiting till crisis happens. But those organizations that are doing that outreach are actually experiencing tremendous and positive results. Providing accessible digital information on a comprehensive COVID-19 policy is, again, part and parcel of what organizations are doing to communicate with their communities. Activate multiple lines of communication, another key thing where you want to be using everything from telephone to newspaper to magazines to social media. Obviously has got to play a huge role. Getting your staff engaged in social media postings, getting the word out about what things you're doing in your community is really kind of key. And I'll share some of those that some organizations I think are doing very creatively here a little bit later in the presentation. All right, let's go. So we're going to talk now about increased outreach with payers and referral sources. Obviously, two, again, key constituents in the business development ecosystem. And again, understand policy changes from payers. Payers are having to quickly change policy on authorizations, on the types of things that they would pay for and not pay for. But that now where you have to stay on top of those and make sure that you understand the changes that are being made within that payer environment. In those environments, sometimes the payer won't even have an idea where there may be a tremendous opportunity by offering a different type of payment for a different type of service. These are open door opportunities I think a lot of organizations should be leveraging. Secondly is the opportunity to collaborate. Again, with referral sources and payers, ask them what their pain points are. What things are they being challenged with within your communities right now? Those are the kind of questions that will give you some form of some answer. There won't be too many payers or referral sources that say, I can't really think of any. There are plenty to go around right now. And again, all of those can be leveraged in a business development sense. Develop a crisis referral program or programs and increase access, minimize or maximize your self-referral. You may have different programs that should be referring to other programs within your environment and in a more pragmatic way as well. So those are the kind of things you want to make sure are very hardwired into your into kind of the new ecosystem that you're incubating as a result of COVID. Increase fees, rates, and services. We've seen across Open Minds clients there's lots of negotiation happening here in a very fluid way right now, in terms of the ability to increase fees and rates simply because the services are more challenging to deliver in certain types of settings right now. So those are the kind of conversations you should be having very readily with payers and also really talking to your referral sources about as well. Innovate and prove your worth to payers and referral sources. A lot of times it's not top of mind for them, but when you develop something great that really addresses individuals in this crisis environment, or maybe it's those that you had been developing prior to COVID-19, the reality is that it's something again, it's an opportunity to have that conversation now. And again, we're in a different kind of world that we live in terms of virtual delivery systems, et cetera, that you may be innovating, and you want to make sure that that word gets out in terms of the way you're responding, your organization is responding to your community needs. Let's continue. Repurposing and repositioning for a virtual market. And we certainly have seen, the pivot to virtual being a key attribute across all of healthcare right now. And again, not all healthcare services can be delivered in a virtual way, certainly. We've seen tremendous success in biometric device development over the past few years. But again, all of that's being accelerated right now simply because of the fact of the needs that are being placed on the system and the stress that's being placed on the system as a result of having to go virtual. So again, development of telehealth, telepsychiatry, that kind of converts a brick and mortar service that is convertible, and that should pretty much almost be universally all your outpatient services, could in one way, shape, or form perhaps operate on a telehealth, telepsychiatry platform. Those are tremendous opportunities. Virtual school-based services. If you're in a developmentally disabled environment and those are, your consumers, that is a tremendous opportunity, again, to move to a virtual-based school environment. A lot of schools across the country have had to pivot to a virtual school environment. There's a lot of lessons to be learned, and you can learn those lessons quickly, pivot to them quickly, and actually deliver it on a virtual platform. Online respite for parents. Parents are experiencing an enormous amount of stress. You think about it, you have, especially those with young children, they're now working from home and the schools are closed. So they've got the pressure of having, younger children and keeping their attention, as well as, the parents themselves having to learn a whole new skill set about working remotely. A lot of those create tremendous amount of challenges. And really the development of a respite service, a virtual respite service, is one that could be obviously developed by any of the behavioral health organizations for a time of crisis. EAP type relief for local employers. Employers are experiencing a tremendous amount of additional potential spend with their own self-insured plans, for example. But to the degree that you can actually deliver an EAP kind of a model, an EAP light or even an EAP heavy kind of a service that actually offsets some of that model, in addressing the mental health concerns and addressing some of the concerns that we talked about that are going on as a result of COVID-19 with anxiety, depression, and addictions. All of those are right in the wheelhouse, so to speak, of this audience. Those are ones that you should be really kind of focusing on. And virtual hospice, sadly, we've read stories about how end of life is happening and no one is able to spend, time with a loved one prior to them passing as a result of contracting COVID-19. There is an opportunity there for virtual hospice services, I believe, where you're really kind of dealing with hospice at an end of life in a virtual. And again, it sounds very non-personal, especially for those that have been through a hospice environment with a parent or a loved one. The reality is that the opportunity there is, because right now there is very few, if any, delivering hospice on a virtual platform. Again, another opportunity. I'll give you an example here. One example, MindPath Care Centers encourages consumers who had COVID-19 symptoms or those wanting to practice social distancing to seek out or switch to a telehealth appointment instead of canceling. Great example of, rather than just shutting your doors, do something proactive. So and they also developed this kind of idea of a virtual waiting room for walk-ins. So again, to the degree that you can make this pivot to this tele environment, really serves your organization well. It's not a holy grail. It's not an answer to all problems in the way you should be delivering services, but it does bring you a long way down the road in terms of, especially if your key focus around outpatient services. There's a lot of things you can do, and they extend way beyond the traditional treatment environment. You have to really kind of, again, get out of the box, so to speak, and really kind of develop a whole new mindset around the way services are delivered. Okay, let's continue. Strategies for maximizing revenue. I developed these 10, there are probably another at least 100, frankly, But these are really the key ones for me. Measure and reduce practice variation. Again, to the degree you've got time now to really look at data, look at the statistics around service delivery, and see where, what does best practice look like in your facilities? Look at practice variation in terms of who is doing it well, and what is it that they do that actually makes it uniquely better or more effective. Perfect opportunity to do that. Increase capacity. Again, through a geographic expansion, a telehealth expansion, other types of capacity increases, or you may be just doing a simple, straightforward pro forma about how you're going to add beds if you're in an inpatient or residential environment. There are a lot of things that you should be doing in terms of thinking about how you're going to increase capacity because the needs are growing. Focus and grow your best consumer. What is it your organization is great at? What is it that and again, I talk to so many organizational leaders, and in the quick response is, we're really great at everything. And the reality is that you're probably really great at a few things, or maybe one thing that you could really, really tout in your community. And that's what you really need to focus on, is who is that best consumer, and what is it you can do to kind of wrap yourself around the idea of how to take and make them raving fans so that they're carrying your flag. Maximizing collections. My colleague Ray Wolf spoke about this last week, but figuring out a way to maximize your collections. A lot of organizations, sadly, they will shoot a bill out the door in a fee-for-service environment and just wait for it to get paid, and what doesn't get paid, they don't really chase. They don't really have a lot of kind of stamina when it comes to collections. This is an opportunity, again, to maximize those collections, to look at your aged AR and really be able to go after that. Where are the opportunities? You increase consumer satisfaction. I believe we're in an environment where consumer satisfaction in our environment will be paramount in terms of differentiation. If you think about the social media reviews and the word of mouth that happens in a community. We know healthcare is local, and I don't foresee that changing. But the reality is, you want to make sure that your reputation is high visibility in those positive experiences. Boost your referral loyalty. More of a hands-on approach to approaching. If you don't have business development individuals or others calling on your referral sources, and I mean, you could pick up the phone, you could be writing notes, there's lots of things you could do to kind of boost that referral loyalty to your organization. Letting them know statistically how many people you've seen, what kind of impacts that you've had in their lives. Those are all good things. Case studies. Renegotiate payer contracts is something that you should be looking at. You should look at pragmatically whether your job revolves around the idea of negotiation of payer contracts, or whether that is an aspect of your job. This is a perfect opportunity where you should be lining that up, figuring out what months, what contracts should be renegotiated, what data that you're going to need to be able to kind of, have that conversation with a payer about the great things that you're doing for the consumers that matter most to them. Innovate around service delivery. And again, beat this dead horse here, but the reality is that there's plenty of opportunity right now to kind of pivot to this virtual model and pivot to ideas about how you're going to deliver services in different ways to different constituents that aren't necessarily just seeking out your services. There are methods that organizations are using to go into the community to deliver these services in unique ways that we've talked about. Participate in a regional ACO, health system partnership, for access around ER diversion. Another, ER diversion is the bane of the existence of any general hospital. They do not want, for example, severely mentally ill people coming into their ER 4 or 5 times a month, each individual, and having them go through a readmission process. There's an opportunity to go and partner. There's lots of organizations that Open Minds works with, and they've done some enormously innovative things around partnering with local hospitals. I can think of a number of those, but again, that's one that each organization really needs to be thinking about and trying to forge those partnerships, especially now that you have the opportunity and the time to be able to do some of these. Develop specialized services for certain populations. Maybe there are, primary care that you're going to deliver for a very specialized, hard to deal with population in a primary care setting. There's so many things that you can do with those kind of services that might be very, very unique, might be highly focused, and you may see your referral base come from way outside of your geography where, historically depended on your county or maybe a few counties around you. This is an opportunity to kind of innovate around the idea of developing specialty services for certain populations. Let's continue. Quickly, revenue generation, this is my checklist again. I think it really comes down to 5 components here: building, assessing, enhancing, optimizing, and then assuring. So again, that online presence in the build part is really critical. If your organization has not really done much or done a whole lot with social media, it is something you absolutely have to have. If your website isn't something that you see people gravitating back to for information, it's one that you want to consider retooling for. And it's something that we do. We work with many clients around their web presence and how it is that they're projected to the outside world, and providing information to both consumers as well as your business partners across your community can provide that push-pull that's necessary in terms of building that online presence. You're assessing the changes needed in your web presence, looking and figuring out how you're going to drive volume through that presence and those activities, those virtual services that could be delivered in a timely way. But assessing those is really important. Enhancing your online presence, by improving performance of your website. And again, if it's not something you focused on, if you have not focused on your online reviews or your social media, if you've not really done many press releases or really kind of gotten the word out, figure out what are those megaphone activities where you can catapult yourself forward. And assuring ADA compliance is obviously one that we always want to be aware of. Okay, let's continue. Service line adjacency. This is something we actually have done a lot of work with organizations across the country on, and that's what services that you can discover that really would be adjuncts or complementary to your existing services that you deliver. What modalities could you deliver that would be unique in terms of a new delivery? And I have a couple examples here. So if you're a mental health provider, developing primary care for severely mentally ill individuals, or if you're in an IDD environment, primary care for high acuity IDD, those are ones where if you have a specialty around those kinds of services, and these are just 2 of literally hundreds that we probably could present. But again, you have to also realize what are the payers paying for these, and where's the value proposition? What does the community need? There's a lot of characteristics that are important. Let's continue. So if you look through, how do I evaluate this process? I kind of broke it down into 4 easy steps. One is, you have to generate a long list of adjacencies. That's that 100 different kind of things that we could do. That's the brainstorm session. That's everything goes down on the whiteboard, so to speak. And then use a set of criteria to narrow down the short list. What do payers pay? What's the community need? Is there a wait list for this service, et cetera? Third, further investigate the 2 to 3 most promising adjacencies, identifying, what ones look the best to you, and then enter the marketplace. Try to minimize, of course, the risk, the financial risk in terms of entering those, which should be part of your evaluation, but it's an opportunity to enter and figure that out in the best way you possibly can do that with a minimalization of exposure when adding those kind of services. Okay. I have a friendly warning. I think this is comes from experience working with many organizations. So number one is, if you're looking at adjacencies and if you don't have a material competitive advantage as a result of that adjacency, that's not an adjacency you want to be in. I've seen organizations do that with disastrous results. A lack of alignment with existing brand and services. In other words, if this is so far off of the beaten path of what you do, it's probably not something that people will equate to your brand in the local community, or will be challenging at best. A lack of material progress on adjacency. So in other words, if it's something where your organization isn't really tooled, you don't have the right people on the ground, you don't want to go through a tsunami of change just to be able to add an adjacency. What you want to do is to look for those that kind of are easier to get into, that are natural for your existing populations, and are additive and have competitive advantage in your area of expertise as well. Okay. So lessons learned and the implications. So I think, again, there's always lessons in both successes and failures. So I think that there are implications to each one as well. So clear ongoing objectives, again, I think help set expectations in a financial framework. You have to have very solid, realistic financial pro forma around anything that you're going to think about. Again, real competitive advantage is necessary. Linking adjacencies to clearly existing brand, which we just spoke about, is paramount that you do that. Don't try to get into a business. Don't, develop an ice cream social stand, in a facility. I'm being kind of funny here on purpose to show you there are some things that organizations have tried to develop that were just so far outside of their what they should be thinking about. Smart kind of toe in the water entry strategy can help mitigate inevitable risk. And again, this is, not going all in, not hiring expensive staff members to try to stand up a critical service that, that you're really kind of just trying to figure out and how to get into without a lot of financial exposure. Critical to keep adjacencies, keep that funnel that we just talked about, keeping it fresh. In other words, this is not something you want to do a one-time exercise. This is something you want to do regularly. Look for those service line adjacencies, develop a formulaic approach to it. Use weighting on each one of the kind of things that matter most to you. Open Minds does a great job in terms of, and I worked on many projects around this idea of identification of service line adjacencies, and we do a lot of weighting and looking at what are the key attributes, how much weight should it be in this environment, around, it's not just, what pays the most, it's what pays the most, what doesn't have, what has the lowest level of financial exposure, what competitive situations exist within the areas you're trying to do, and lots of things go into it. But again, this is an area we certainly can help you with. Organizational separation from business as usual activities, I think is a really kind of a final prerequisite for success. In many organizations have not followed that, and again, this is something you want to make sure that you have the proper measurement, you have the proper infrastructure, you have the proper IT systems in place to be able to support it in a holistic, integrated way into your service delivery system. Let's continue. Diversifying through geographic expansion. And we'll just kind of quickly go through this because it seems somewhat obvious here. The community needs, we know, are growing. We saw that earlier based on the data that I was showing you, just on a real simplistic basis. Next. Revenue generation opportunities, there'll be plenty of those, I think, through geographic expansion. Low competitive risk is something you should be looking at, where you don't want a lot of competitors or big competitors in your market to go up against. We know the business. Again, the fact is you want to be going into businesses and standing up new services in geographic areas that you understand and know the population, the consumers, the payers, you're already contracted for. There's so many things that go into this idea of that we know this area. Go ahead. Leveraging with payers. Again, moving into a rural environment where maybe there's nobody in their network and they have a desperate need there. Great opportunity to leverage. Diversification. Again, it might be diversifying into an adjunct service, possible forging of new partnerships. Maybe you're partnering with a new health system, another behavioral health type of provider where you could refer back and forth. Lots and lots of opportunities there around geographic expansion into areas, and you deliver those potentially in a telehealth way. Already have support services in place where you're not having to spend a lot of additional money, a lot of additional resources on putting those in place. Next. Hedge against retail expansion into your market. CVS, Walgreens, Walmart, all of them are getting into healthcare in a retail way, and we've seen it actually happen with mental health as well. Don't assume that, again, it has to also be a brick-and-mortar providers in terms of retail expansion. We see companies like Talkspace moving in across the country in terms of, on a virtual model, and they're changing the commerce model. Broader brand recognition, obviously, will give you that, in terms of geographic expansion, in terms of your good name. Next. Moving closer towards being part of a provider-led entity or an accountable care organization. I believe, and again, I've said this at many conferences that I've spoken at, I believe every single organization that's on this webcast, this web briefing right now, will absolutely be part of a provider-led entity or accountable care organization in the next 10 years without exception. And this is something that, again, I think geographic expansion moves you closer. And here's one example. Centerstone pivoted and offering multi-state telehealth to now delivering, from not really doing much with telehealth to now delivering over 12,000 visits per month. Again, that was enabled through COVID-19 legislation that allowed interstate delivery. So again, now that we're able to deliver, you don't have to be licensed in the state, and hopefully some of that stays in place post-COVID. And again, I think it's got a long runway ahead of us, but the reality is that there's lots of opportunity there for you to, consider, some of the things that have happened legislatively and regulatorily that will work to your best advantage. Let's continue. So other considerations, again, expand via telehealth, expand where you are. Don't think that your first expansion, if you've not expanded before, needs to be across the country. That will be more expensive. That will be more complex. There are other, regulatory things that you need to understand in political environments that you have to understand. Expand to increase access. A very key thing. I did presentations about, what are payers' pain points. It's access followed by access, followed by access, followed by access. I mean, these are high degree of focuses here. Expand to increase access is really taking a leadership, and it sounds simple, but it's one that you need to take seriously. Expanding services where you have a backlog. Don't try to expand services that aren't necessarily moving very well. Actually, a lot of organizations are closing those poor performers down and expanding services where there is a demand. Expanding services to meet payer demand for increased access, which I just spoke about. Expand where your barriers of entry are lower, where you don't have to use a lot of expensive equipment, buildings, et cetera, or personnel. Regulatory, market knowledge, referral sources, competitive services, and management and oversight. All of those you don't want to necessarily, you want to make sure you have a full understanding in terms of your expansion portfolio and decision-making criteria in terms of prior to making that. And again, expand where favorable reimbursements in place. Don't expand to an area or a service that isn't necessarily going to reimburse you appropriately. And again, your decisions must be data-driven. A lot of organizations make decisions based on gut reaction, and those days are past. So fundraising, some creative things are happening in the fundraising side, and this is actually kind of a lot of fun to see here. And here's a few examples here. And again, these slides will be posted. I'm not going to read them to you, but Copa Health here, has done a lot of things with social media in terms of, amplifying events, providing additional information. Henderson Behavioral Health, Dr. Steve Ronick, wrote this letter to the community. It was a fundraising campaign. Grace Point Foundation, Grace Point in Tampa, they had a whole idea around how they're going to do fundraising. Centerstone on the far right did a parent-peer empowering parenting meeting, having meetings and teaching people in your community on how you do certain types of services. All of these are opportunities. Using social media to your best advantage, expanding your brand image are all part and parcel of what you should be doing in terms of your fundraising strategy, especially in this virtual environment that we're in now. Lots and lots of opportunities. Your fundraising should include, your Zoom or GoToMeeting kind of metaphors, doing that face-to-face wherever possible so you're able to connect with people. But there's lots of opportunities you should be doing. So leveraging the unexpected opportunity, again, take advantage of this time. Your fundraisers or people that are engaged in fundraising, have fewer meetings, their events and face-to-face and donor meetings, really can be kind of, switch to a virtual platform, plan on new things. Again, look at things pragmatically. Maybe you've been doing a gala at a certain time of year that really hasn't produced the kind of results in recent years. Get rid of it. Do something new. Maybe do something online. Maybe do something that's completely, different. Learn what other organizations are doing. Success leaves clues, and this is an opportunity. I love the stupid idea. So again, all of us have these organizations with these overzealous volunteers, and sometimes their crazy ideas work perfectly. And this is an opportunity. We're in an environment to give some of those ideas that can be implemented a try. Solicit those from some of your best volunteers. It's a prime moment to boost your social media. Please take advantage of this time and really kind of build your referral sources, build your credibility. Get creative on your contacts. And again, book a virtual tour of your facilities, look for celebrity sponsorship, or if you haven't done that, or if you do have celebrity sponsorship, have them actually maybe do private meetings with some of your key donor contacts. Get personal, write notes. I mean, if you're not writing personalized notes, call donors, write notes to donors and thank them. This is a perfect opportunity at times to do this. So many activities you could be doing. This is not an idle time for fundraising. Let's continue. Identifying competitor contracts at risk. So you have competitors across any environment where there is a risk environment with their contractual situation. So identify a list of all your competitors. If you don't have one, develop it. Identify organizations that are at risk. The rumor mill is usually the best place, or talking to people in your community. Reach out to colleagues that may know leaders within these competitor organizations and make contact with them. Find out if there's a way for you to partner with them in a way that favors your organization. Ask local governmental leaders for knowledge of those organizations that they know are struggling, that they're concerned about, that are delivering key services to your communities. All of those are opportunities. Ask payers, all of your payers, whoever your payers are, ask them this question. Hey, do you know anybody delivering these kind of services that's really kind of struggling right now? Connect with leaders and board members of organizations across your communities as well, and stay open to the different possible working relationships. When you talk about partnering, it doesn't mean M&A work exclusively. There's a lot of different ways you can partner with organizations. Okay. The how-to, identifying those contracts that are lucrative reimbursements, evaluating your capacity. Can you do this? Where are those services? Is it existing locations? Is it telehealth? Is it, developing new locations, de novo? Evaluate whether you have the necessary staffing. Staffing in some environments can be very challenging. Nursing, psychiatry, mental health techs, all of these are make sure that you have the staffing in place, for example, to be able to deliver on this. Identify targeted volume for your community need. Develop a pro forma, make sure that it's financially feasible and optimized, and then whatever pro forma you come up with, I always say add 12% to your expense projections, and then take your revenue projections and decrease them by 5%, and then see if that still looks like a lucrative opportunity for you. But you should be using very, very solid financial metrics to make those kind of decisions. Two examples. A local hospital who's becoming inundated with severely mentally ill in their ER. This is happening across the country, by the way. Your opportunity is, depending on the volume, placing an individual in an emergency room to triage incoming patients to your mental health facility and avoiding an admission to the hospital, and obviously doing the things that you guys do best, right? Next one, problem. A mental health provider to a large local employer has stopped seeing patients as a result of COVID-19. Happening in every community. The needs of that employer have increased, and their employees are now being forced to travel 50 miles to receive services or more, or not getting services at all. And again, standing up a branded telemedicine, telehealth product for a large employer, perhaps with collaboration, and with any primary care or local healthcare providers offering, some type of integrated module or mode would really kind of double benefit you. So if an employer has a kind of built-in telehealth metaphor, maybe talking to that telehealth company about doing mental health and telepsychiatry services are opportunities. Again, get creative in terms of developing these. So number 6, anticipating local organization failures. There are organizations that aren't going to make it through COVID-19. So what service needs are created as a result of this? And I think these 6 things are key. Realizing that a community need does not go away with failure. Hear me out. It does not mean that the community need goes away. As a matter of fact, I would argue that the community need is growing for mental health services as a result of COVID-19. So any organizational failure within your community will only overwhelm the system even more. So be ready to leverage that to the degree possible. Develop an outreach and communications plan for referral sources. So as you see organizations fail, you should be talking to every referral source that could possibly be referring about your services, and that you are there to take care of them. Realize that your opportunity might be in the formation of a partnership that further integrates care, or creates a partnership to care for patients that would otherwise be left without. We've seen failures happen throughout the country that have put a lot of folks in need of mental health services out on the street, and essentially trying to anticipate that to the degree possible is really key. Developing broad web and social media outreach, and anytime you see this kind of failure, establishing relationships with media, your local television news channels, and any kind of organization that really would be able to deliver your message on a media platform, newspapers, et cetera. All are very, very important in terms of really anticipating and getting ready in advance of organizational failures. Don't wait till it happens. Get a plan together now. Next. The how-to, Don't buy another organization with problems. If another organization is upside down financially, you do not want to bring that organization and all of its problems in. You want to make sure that you have, opportunities that you could have clear line of sight to those service lines that are complementary to yours. Not-for-profit organizations, consider affiliations and without clauses. With again trying to lower your risk profile. Consider starting a for-profit entity that would develop a joint venture that could raise capital for for-profit organizations. Or if you're a for-profit organization, consider an asset purchase versus a stock purchase. And again, leave the liabilities behind where possible. And again, lots of opportunities, sadly, I think, through organizational failures are going to happen as a result of this crisis. But again, you have to be very smart and planful about it. Don't think about it once it's happened. Think about it now. Consider organizational cultural match. Very, very key. You want to make sure that you're dealing with an organization that is very carefully aligned with your mission, your purpose, your why, if you will, in terms of what it is that you're about and whether there's a good cultural match. Don't get caught up in the who will be CEO focus. Focus on the health and well-being of your organization and their organization in terms of what's going to be best for the enterprise going forward if there were put together. So exploring avenues for government support. This is one that I think there is changes almost on a daily basis. And I think, you staying and keeping up to date with the Open Mind Circle is so key here. But again, we know Congress has appropriated $100 billion to reimburse providers for lost revenue and increased expenses for this COVID coronavirus pandemic. The funds are being distributed by the Health Resources Services Administration section of HHS. The funds do not need to be repaid in the terms and if the terms and conditions are met. And the providers are receiving a portion of the funds based upon their share of the 2019 Medicare fee-for-service reimbursements. And the funds, which go to the TIN that normally receives the Medicare payments, can be used for healthcare expenses for lost revenues. And I've got a URL, and again, all these slides will be posted for you to go and kind of dig into this a lot deeper for your organization if you haven't been able to kind of leverage this. Let's continue. Avenues of who to address, and these are just some ideas. There are many, many more than this, but check your governor's website. In every state, that your governor's website will have a what's going on and where some of those programs are. There's the governor's office addresses and websites are on this web address that I have on the slide here. Your county commissioners, your local mayors, your local state and congressional representatives, your local community support organizations, and especially those that are offering and can offer grants. United States congressional representatives, again, somebody you want to be doing outreach to. The U.S. Small Business Administration, which has a loan and debt relief programs for Paycheck Protection Program, or PPP. IRS has new credits for businesses. Federal Communications Commission has $200 million set aside for telehealth initiatives. And the Securities Exchange Commission, SEC, is providing temporary and conditional relief for companies to raise capital via regulation crowdfunding. Lots and lots of opportunities. But again, this is one you have to be intentional about and dig at. So let's go on here. I put together just some examples, and there are examples for every state, but these are some simple examples of, California, Colorado, Connecticut, Florida, Illinois, Louisiana. And if you go to the next slide, my examples will include New Jersey, New Mexico, New York, North Carolina, Pennsylvania, Washington. If you're not in one of these states, it was only because of the fact that I didn't want to have like 20 slides additional in this deck. But each state has very specific ways that they're either providing grant funding or specialized loans with long repayment programs, 20 plus years in some cases, for loans to organizations in need right now. So those are ones that you want to absolutely be on top of, because they will be with favorable terms like you will never see again. But all of these slides will be posted. So make sure that you take a look at and you investigate what's going on within your state or the states you operate in terms of opportunities to either get loans or grants, and grant funding being obviously the key one here. Let's continue. So other noteworthy changes, you have the risk evaluation and mitigation strategy for drug projects, the Medicare quality reporting, and CMS announced exceptions for reporting requirements in that program. Telehealth, you have new CMS changes for billing for audio only. It was retro back to March 1st. the use the codes as if they were delivered in person. So that means that, you can deliver an audio only in some situations and be paid for, as if you visited with a person individually one-on-one. Lots and lots of things that you really should be looking into. And again, to the degree that we can help you with resources from Open Minds, we have tremendous outreach in terms of identification of these. Let's continue. So commercial payers, every commercial payer has very, very new guidance that's going on as a result of the COVID pandemic. These are ones that you want to make sure that you, again, once the slides are posted, that you go in and find out what's going on, what things are different, what authorizations have changed, what's different about the way they're paying. Maybe they're paying a higher rate for certain kinds of services. Maybe they weren't paying for telehealth before and now they are. Make sure that you get this guidance from commercial payers. And if you have questions, obviously let us know. We'll be happy to help you. Your organization to-dos, these are kind of the way, if you didn't listen to anything else I've said, do these things. Evaluate the expertise needed and hire the experience you need. Is the leadership team in place to be able to take you there through this crisis? Very key question. Convert brick and mortar services to virtual offerings wherever possible. And again, do you have the experience to do that, to lead the conversion and to help train staff? Do you have that capability built into your environment already? Next, ensure online capabilities and support your brand and aid in growing revenue. And again, does your website, consumer satisfaction ratings, your consumer portal, et cetera, all support those initiatives and that top line revenue support? Develop specialty services that supports very specific populations. Do you know what populations you're really great at and what specialization that you could be put in place with payers that you would otherwise not know? This is a time to do that. And lastly, gain the market intelligence. And again, this is something that Open Minds can help you with tremendously. Do you have the market intelligence to drive the right marketing activities that will add top line revenue maximization? And maximization is all but so key in terms of this time and dealing through this crisis. But these 5 to-dos are paramount if you are a leader in your organization to be able to get on top of as soon as humanly possible. Okay. So Mia, I'm going to turn it back to you. I know we've got some existing questions. I don't know whether we want to take these or whether we've had any come in throughout the last hour from those attending.
Sure. First of all, Paul, thank you for that fabulous presentation. I feel like I could venture into short-term aggressive business development after listening to you. It was inspiring. Can you talk a little bit about what you said earlier about upskilling and downskilling? When would you need it, and when is the time to start implementing those strategies?
Well, a lot of the focus again is new skill sets. So a lot of individuals, and it's funny, I was talking to a primary care physician that does a lot of work with mental health, and that individual had never done a telehealth visit. In the span of a couple of days, he had to learn how to really be a constituent participant in a telehealth model, and he was able to learn that, and he actually now favors doing telehealth visits. It's a great example of upskilling, taking something that you're already a specialist and expertise in and being able to do that broadly. The other thing is that he's able to see way more patients on a daily basis than he was previously for things that he didn't necessarily need a direct in-person contact with. So he's able to really kind of scale his practice in a very significant way, and he's actually in a large group, so he was able to scale with other individuals as well, and that in-house referrals that went back and forth also increased as a result of this platform.
Thank you, Paul. Great example. And so obviously, anytime we are thinking about business or an expansion of business, there's the competition to consider, right? Can you talk a little bit about who it is we have to contend with if we adopt some of the fun ideas you presented?
Yeah, I think, again, not to be overly focused on the telehealth model, but I have to think it's so important to think about it this way, is that technology, not just telehealth and telemedicine or telepsychiatry, there are other technologies now that are available. They've been available. They're just now higher visibility in terms of really kind of doing almost replacement services for things that are been going on that you do in a brick and mortar environment. This is the time to look at and adopt a lot of these innovations that are kind of naturals. And again, you have to kind of change your mindset. A lot of companies, even the ones that are just delivering a telepsychiatry or telehealth or telemental health model, have completely different revenue models. Like Talkspace is $1 a minute. Others, are delivering urgent care light for $25 a year plus $1 a visit. So there's things that are breaking the economic equation completely. But again, these are well-funded, vetted companies. And again, I'm not saying that necessarily those should be your only focuses. By the same token, your local competition, because healthcare is local, but realize through a virtual model, there'll be many more competitors that will never have to build a building or move people into your community to really make an impact with your patients that you've been seeing, and be able to hopefully, in their case, they're hopeful that they're able to deliver the higher quality at a lower cost. So again, realize that your competition is coming, even if it's not tomorrow, it will be coming in a very rapid way. And again, I think the acceleration of this has happened as a direct result of COVID-19 and the social distancing that has to take place as a result of it.
So Paul, when is a good time to start strategizing and to start moving forward with implementing your plans, because we are still in crisis mode? Do we wait for this to be over before we start going down the path of innovation?
Yeah, it's interesting because we've all kind of grew up with the idea of developing 5-year strategic plans, and I think in the last couple of years, the mindset has changed pretty radically. We're developing at Open Minds, we're developing 18-month strategic plans. With COVID-19, we're developing 30, 60, 90-day plans to kind of get through this, because nobody really knows for certain what it's going to look like. But the agility it takes to basically make it through the short term, the level of innovation is so significantly greater that you actually are forced to innovate in many ways that you wouldn't even think you would have to as a direct result of this crisis. So you're planning, if it hasn't taken place in the past, and even if it has taken place, you should be trying to, every 30, 60, 90 days, really rethink your strategic plan in terms of what's in front of you now. What is it that we know that we didn't know last week, last month? That really changes service delivery, that changes potential revenue and expense equations. All of these have to play a role in terms of how we're going to develop the business to go forward in terms of where opportunities lie in front of us.
Okay, great. Paul, I think that covers the questions coming in. Either you answered them all or you scared us off with the thought of business development. Just kidding. But do you have any parting words of wisdom or any wrap-up comments before we?
Yeah, this is again. We live in very, very precarious times that none of us could imagine before. They're calling it the 100-year event. Realize that we at Open Minds are pivoting along with our clients, and I know a lot of you are close partners, and we want to be an asset, a resource for you, and we have lots and lots of capabilities, and we're learning at the speed of thought, so to speak, across the country, and we want to be able to share those resources with you. And I think this web briefing is one way to do that. I think also just let us know how we can assist you in outreaching and really kind of sharing that experience, and rather than having to take a lot longer to learn it or develop it, if we can assist you in any way, we certainly would love the opportunity. But thank you so much for your time today. It's been an honor to spend this time with you.
Great. Paul, thank you again for a great presentation, and I want to thank all of our attendees for taking the time out of crisis management mode to join us and to benefit from some of Paul's great ideas. I would invite you all to register for the next web briefing in our series. That's a week from today, May 21st same time, 1 o'clock Eastern. And another senior associate from Open Minds, Ray Wolf, will be talking to us about 5 steps to manage our cash flow aggressively. So you don't want to miss that one. It goes hand in hand with business development, right? Cash management. So hope to see all of you back there. And please visit our website, sign up for the web briefings, and watch your email for a link to the slides from today's web briefing as well. Thank you all and enjoy the rest of your day.
Thank you.